NREMT Questions 2026 Emergency Medical Technician Practice Test, 25 Essential Questions. Question 1. An EMT notices an expired EpiPen while restocking. What should they do? Continue using it until a replacement is found. Throw it away and go without. Replace it immediately with an unexpired one. Mark it expired and keep it for training. Emergency equipment must be unexpired and functional for patient care. Question 2. What is the first step in the primary assessment of a responsive patient? Assess the airway. Check the pulse. Form a general impression. Obtain a blood pressure. General impression helps prioritize the rest of the assessment. Question 3. A patient is breathing 28 times per minute with shallow respirations. What is the best intervention? Oxygen via non-rebreather mask. Oxygen via nasal cannula. Positive pressure ventilation, BVM. Monitor and transport. Fast and shallow breathing indicates inadequate minute volume, requiring BVM assistance. Question 4. What is the standard treatment for a patient with a suspected tension pneumothorax in the field? Needle decompression, if ALS. Occlusive dressing on 3 sides. High-flow oxygen and rapid transport. Performing a tracheostomy. BLS providers focus on oxygen and rapid transport. ALS may perform decompression. Question 5. Which rhythm is shockable by an AED? Azystole. Ventricular tachycardia, pulseless. P. Normal sinus rhythm. AEDs shock VFib and pulseless VTach. Question 6. A patient has a traumatic injury with bright red, spurting blood. This is likely venous bleeding, capillary bleeding, arterial bleeding, internal bleeding. Arterial blood is oxygenated, bright red, and under pressure, spurting. Question 7. What is the correct depth of chest compressions for an adult in CPR? 1 to 1.5 inches, 2 to 2.4 inches, at least 3 inches, as deep as possible. Current guidelines specify 2 to 2.4 inches, 5 to 6 centimeters. Question 8. Which of the following is a sign of compensated shock? Low blood pressure, altered mental status, tachycardia, weak, irregular pulse. In compensated shock, the body maintains BP by increasing the heart rate. Question 9. When treating a conscious choking adult who cannot cough, you should perform chest compressions, back blows only, abdominal thrusts, Heimlich, finger sweep. Abdominal thrusts are the standard for conscious airway obstruction. Question 10. What is the golden hour in trauma care? The hour after an accident where survival is most likely if treated. The first hour of an EMT's shift. The time it takes to get to the hospital. The hour before a patient goes into surgery. The goal is to get a trauma patient to definitive care within 60 minutes. Question 11. A patient presents with tearing back pain and a difference in BP between arms. Suspect myocardial infarction, pulmonary embolism, aortic dissection, kidney stones. Tearing pain and unequal pulses/BP are hallmark signs of aortic dissection. Question 12. What is the Glasgow Coma Scale, GCS, range? 0 to 10, 1 to 15, 3 to 15, 0 to 100. GCS ranges from 3, worst, to 15, normal. Question 13. In the sample history, what does the L stand for? Location of pain, last oral intake, level of consciousness, length of illness. S equals symptoms, A equals allergies, M equals meds, P equals past history, L equals last intake, E equals events. Question 14. Which organ is located in the right upper quadrant, RUQ? Spleen, appendix, liver, stomach. The liver is the primary organ in the RUQ. Question 15. What is the compression to ventilation ratio for 2 rescuer infant CPR? 30:2, 15:2, 5:1, 3:1. For infants and children, 2 rescuer CPR uses a 15:2 ratio. Question 16. What is the primary concern when a patient has a stridor sound? Lower airway obstruction, fluid in the lungs, upper airway obstruction, asthma attack. Stridor is a high-pitched sound indicating narrowed upper airway. Question 17. A DNR order is valid only if it is signed by the patient only, verbally told to you by family, a signed, legal document present at the scene, stated in the patient's diary. EMTs must see a valid, signed legal document to withhold resuscitation. Question 18. What is the appropriate rate of ventilations for an adult in respiratory arrest? 1 breath every 2 to 3 seconds, 1 breath every 5 to 6 seconds, 1 breath every 10 seconds, 2 breaths every second. Adult ventilation rate is roughly 10 to 12 breaths per minute. Question 19. A patient is postictal. This means they are currently seizing, recovering from a seizure, about to have a seizure, refusing treatment. The postictal state is the period of confusion following a seizure. Question 20. Which of the following is a symptom of hypoglycemia? Warm, dry skin, fruity breath odor, cool, clammy skin, extreme thirst. Hypoglycemia, insulin shock, typically presents with rapid onset and cold and clammy skin.